Morning, everyone. This is your girl, Marla McCants. I'll be going live. I'm live now. I joined this organization called Lost, lending our shared stories, and we're doing amazing, great things here. I'll be talking about lymphedema this morning, and this affects me because I have it. So it's very important to me to get this information out. Hello, everyone. I'm working on 2 channels, so bear with me. Call in 319-527-4257 and be a part. Here's some information. It may affect a loved one, may affect yourself. You see someone out in the streets and they look a little funny, could be the reason. So do call in again at 319-527-4257. Morning.
Mama, I'll bring you on here shortly. We're getting ready to just introduce. We're going to get started. We're going to give it another 30 seconds. And so we get the people on Marla will be going live. I'm going to hear from her. But I think, are you all set up, Mama? Get your equipment set up?
Yes, I'm all set up. I'm live on both channels.
Okay, all right. So let's get it. We're going to give it 45 seconds, guys. And then we're going to begin the call for those that are coming on. We're just going to give it about 45 seconds. Feel free to tag people to let people know that we're now on the last call. If you will. So we'll give it another 15 seconds, about another 20 seconds, and then we'll begin because Marla is going to talk and when she comes, but she'll find some people who will call in.
Yes, y'all. I only have 20 minutes, so please bear with me. It's an important information topic. I only have 20 minutes, so I'm going to try to cram everything in 20 minutes. And then afterwards, if you want to hit me up on Instagram or on message me, get in touch with my manager, Trina Gordon, and book me to speak at your job, at events or anything. Just get in contact. Okay. I'm on the telephone. This is a telephone conference, so bear with me again. I hope you can hear this.
We're going to be bringing every week experts and people that, whether they suffered a loss, we're going to introduce prayer, we're introducing topics that we're talking about. We're going to ask them right now that you come on and you can use your phone because sometimes we have noises in the background and we don't want the information to be distorted or misinterpreted. So we are here to welcome you on behalf of myself and Founder Law. I want to welcome you to this conversation. Our special guest this morning is Marla McCants. Marla McCants is a native of Detroit, and she is now a Tennessee, and she's very curious about lymphedema and how dangerous it can be. Oftentimes, we don't know enough about this disease, or sometimes we may look at a person and see that their legs are excessively swollen, but we just don't understand. So I pray that the Lord will just make us more kind and just have more empathy for people going through this. But as we all know, that God does make a way to healer. So I want to introduce my friend this morning, part of the Lost Network, one of our platform speakers, and also who will be seen on Sister Circle TV next week. She is known by Marla McCants. So I want to welcome you all to this phone line talking about lymphedema. And here is our guest today, Miss Marla McCants. Welcome, Marla.
Good morning. Thank you, Treva. Thank you. First of all, I want to give thanks and honor to God, who is the head of my life. I also want to thank the Lost Events for having me to speak this morning on a subject of lymphedema that affects me, that I have it. And I know I only have 20 minutes, so I'm going to try to cram all this good information in 20 minutes. I am going live on 2 channels, so please bear with me. Lymphedema. Lymphedema refers to the swelling of generally occurs in one of your arms or legs, sometimes both arms and legs, or also other parts of your body too. Not to be confused with edema. It is usually caused by an excess tissue fluids that have not yet returned to the circulatory system. Lymphedema is a swelling caused by excess protein-rich lymphedema trapped within the tissues. Lymphedema is most commonly caused by the removal of or damage to your lymph nodes as a part of cancer treatment. It results from a blockage in the lymphatic system, which is part of the immune system. The blockage prevents liquid fluids from draining well, and the fluid buildup leads to swelling. Your lymphatic system is crucial to keeping your body healthy. It circulates protein-rich lymph nodes, your white blood cell fluids throughout your body, collecting bacteria, viruses, and waste products. Your lymphatic system carries this fluid and harmful substance through your lymph vessels, which leads to lymph nodes. The wastes are then filtered out by the lymphatics, infection-fighting cells that live in the lymph nodes, and ultimately flushes from your body. This means your urine is the only way of getting it out. So you think you could stick a needle in it and draw the fluid out? That's not how it works. Lymphedema can be either primary or secondary. This means it occurs on its own, primary lymphedema, or it can be caused by another disease or condition. Secondary lymphedema is far more common than primary. The causes of secondary, any condition or procedure that damages your lymph nodes or your lymph vessels can cause lymphedema. The causes: surgery, removal, injury to your lymph nodes and your lymph node vessels may result to lymphedema. For example, lymph nodes can be removed to check your spread of breast cancer, and lymph nodes may be injured, due to an injury to your blood vessels in your limbs. Radiation treatment for cancer, it could be radiation can cause scarring and inflammation in the lymph node and its vessel. Cancer or infections. Primary lymphedema is rare. It's hereditary, and that's what I have, and how I got it. I call mine hereditary. Hereditary conditions caused by problems with the development of your lymph vessels in your body. Congestive lymphedema, lymph nodes, begins at infancy, so babies can have it. You can be born with it. Babies have it. It affects everybody. Sometimes you get it when you reach puberty, pregnancy, or any age of 35. They say 35 or older. The risk factors. This would be considered obesity, weight gain. You can get it older age, rheumatoid arthritis, those kind of complications. Lymphedema is usually in your arms and legs, but like I said, finding out it can be in other parts of your body is also. So if you're out in the streets and you see somebody with big arms or legs or their body convulsion, keep in mind that this could be it. It's lymphedema, and that is, the difference with that is fat cells clogging together, sticking together. That's what I had first, and this is what I've been learning since I've been researching and asking questions. I had that first, and that led to my lymphedema. You think of lymphedema as you have a sponge, and you take and you pour water on that sponge, and it keeps expanding and expanding and expanding. But if you compress the sponge, the water won't get in there. It won't get in there, so it won't get a chance to spread, because it keep on spreading and spreading and spreading. It just worsens, and at the end of it, in my opinion, for reading the information, it's cancer. Bottom line. Okay, so back to the subject. Okay. Yeah, you can get infections. Possible cause of infections can result to lymphedema and serious bacterial skin. It's called, oh yeah, cellulitis. At times I flare up and I get cellulitis. It's when your skin, your tissues up under your skin are very, very sensitive. It's very painful, very discomfort. Right now, I might as well tell the truth. And truth, your point is my hashtag. I'm sick right now. My leg is infected. I had surgery on my legs. A no. Never cut on lymphedema. It just worsens. So later on today, I'll be going to the doctor to get checked out, undergo some antibiotics. I hope I don't wind up in the hospital again. It usually a 7 day of some antibiotics through the IV. So y'all pray for me out here. So don't let nobody tell y'all to cut on lymphedema. It's a no. It's a no. How do you detect lymphedema? Doctor, they usually go do an MRI scan, a CT scan, a Doppler ultrasound, or you can get radiation images of your lymphatic system. There is no cure for lymphedema. It's a chronic disease. I'll have it the rest of my life. But there is treatment out there. Treatment focuses on reducing the swelling and controlling the pain. This would include exercise, wrappings, massage, and compression. Recently, I've been, like I said, into this lymphedema, and I found out that there are a lot of things, a lot of companies out there that have these compression stockings. They come in a lot of colors. Yes, it is costly. I think that's a little unfair. I go twice a week and have my legs wrapped. I have a massage done. There's pumps that you can do at home. I did a video on it. So there are treatments. Don't sit at home. Lock yourself in, and don't do that. There is help out here. I wish people who suffer with it get out and tell more of their story. As I'm learning, I went through this not just for me, but to help others. So I want to educate my brothers and sisters on what I'm going through and what I'm learning. Scientists also believe genes are involved, like I said, because many women with this condition have members. And like I said, I got it hereditary. What else? Lymphedema affects up to 15% of women. It happens when fat is distributed in an irregular way beneath your skin, usually the buttocks and legs. Although it begins as a cosmetic concern, it can eventually cause pain and other problems. You see big people with big legs and big booty and big breasts, big arms or something. Yeah, they need to get checked out. The typical symptoms of that are the large lower half of your columns of your legs, which are often tender and bruise easy. Yes, because I bruise easily. For example, the top half of your body may be an 8 and the bottom half a 16. Like I said, I've been heavy all my life. My legs is the heaviest part of my body. And as the condition progresses, fat continues to build up and the lower body grows heavier. And also it can go in your arms. Over time, and which has happened to me, fat cells block the vessels of my lymphatic system, which normally helps balance the body fluids and levels and protects against infection. So you can see you see this system, you have blood in your veins. We have blood. We have water. in our body that circulates. And we have a circulation that gets rid of bacteria. And mine is trapped right now in my legs. That's why. Um, the blockage prevents the proper damage to the lymph fluids, leading to buildup fluids, and that causes the lymphedema. If not treated, lymphedema can lead to problems such as infection, delayed wounds, healing, scars, fibroids. That's where your skin gets real hard. You see people, their legs get so big or arms get so big or another part of their body gets so big and it gets hard and it discolors. It's heavy, unattractive. Back in the day, they used to call it elephantitis because if you look at the images, it kind of reminds you of an elephant. You know, the skin, the texture, and everything. It, like I say, this it hardens the skin. The cause is not known, but doctors suspect female hormones play a role. That's because the conditions affect mostly women, and it often begins and worsens at puberty or during pregnancy or during surgery or menopause. So I hope y'all take this into effect. Keep watching. Keep following me. I've joined TLC, Total Life Change. I'm doing this challenge, a 30-day challenge. Thank you, Christina. So I will let you know how that goes and if it works for me. Like I say, I wanted to be honest about everything. I think it's bad in the world now that you get out and people telling you this and that and it's not true. I really dislike that. Also, I want to tell y'all about Lost Events. We're having a coat drive December the 21st. It'll be in 9 cities. I'm doing Gallatin area here in Tennessee. The coat drop-off will be at the Taste of Sea restaurant on 375 Magnolia Street across from the Zaire Upper Room Church. We're in need of coats or donations. We're asking that you get it to me before, or at least by the 19th of the month. Also, the Lost Meeting meetups, you can be reached at 270-881-0172. December 7th, we're going to meet at Jolie's Bakery and Cafe in Hopkinsville, Kentucky from 2 to 3 p.m. Hashtag we're changing the game. Reach out and contact me and let me know what you think. You can reach me at truth_your point on Instagram or www.facebook at marla.mccants.1. Tell me how you like me. Get in touch with my manager, Treva. If you want me to speak at any events, I'll be on Sister Circle next week in Atlanta, Georgia. And stay in contact with me. And Treva, I'm going to turn it back over to you. I do thank you. Lost, like I say, this is a great organization. Please join us. It's wonderful. You're getting out, you're meeting. I used to be trapped. I used to say I was just existing in the world when I was heavy and 800 pounds trapped indoors. My life consists of internet and TV. And I want to tell y'all, it's very lonely. I'm existing now. I'm no longer existing. I'm living now. So come out, show your support, and I'm going to turn it back over to Treva.
Yes, Marla, I have a question, and thank you all for joining. It was a little hard to give you all my end and typically mine. I want to thank everyone. Continue to have your phone seated. I just have like 3 questions that will help the community. One had one thing on the show last week on the time, like you tell everyone the size that you were and how did you balloon to that size?
Yes, everyone. I was on TLC's My 600-Pound Life. I weighed 800 pounds. I found out through going through therapy it was because I was raped, molested by my father, and I was kidnapped. So I stayed indoors. I didn't want to endanger anyone. I stayed indoors and found comfort in food. I ballooned up. And that's how I got to be that way. And what else did
Okay.
you
And
say?
since the lymphedema, how have you had lymphedema all of your life, or was it really after you had weight loss surgery when they cut on you? When did this problem first begin?
I was born with it. Like I said, I always had heavy legs. I've always been bottom heavy. I didn't find out until 2011 that I had lymphedema when I reached out and was going through a weight loss program, and I seen a doctor here in Murfreesboro, and he told me I had lymphedema. I was like, who, what? You know, and it was a shock to me. I'm not the kind that didn't go to the doctor. I went to the doctor. I went twice a year, and it's just amazing how doctors, the medical profession sucks. They don't know. They don't know. It still boggles me at times that I had this condition, and I had one doctor tell me that he apologized, Dwayne, and he said, yes, I never thought about that. You know, everybody kept telling me, well, lose weight. I was taking water pills. It wasn't water. It wasn't that. So I've had it all my life, but after I had the surgery and I had the skin removal of my legs, which was a no-no, um, the lymphedema has gotten worse. Like I said,
And
firsthand.
how can you tell when it gets worse, Marla? What are some of the signs if a person is on this line that's suffering or they know someone? How can you tell that it's getting worse?
It hardens your leg more. My leg hardens. It gets red. It hurts and aches. That's how I found out that I had infection. It's no fun. So, like I said, my leg is now big. I know it's infected. I'm going to the doctor today. It's turning red, so I know to get into the doctor's antibiotics, and hopefully I don't have to go into the hospital. But that's how you
And
know.
we're praying. Our prayers are for you this morning, and those that are on the line, we're showing support and love for Marla. If you missed her conversation, she was sharing about lymphedema and how it has affected her. And she is going today to the actual hospital because the leg is infected. It's swelling, it hurts, it's red, and she may have to be hospitalized after today. So this call was important because we want people to know the dangers and the seriousness of lymphedema, and we want everyone to have more empathy. Just because you're not going through it doesn't mean that someone else isn't, and because they are, we should all be a little bit more kinder. And I just wanted to, where I've never suffered lymphedema. I don't have a person in my family that I know of who has lymphedema, but I wanted to gain an understanding and have a heart for people because I see so many people and they have that one leg or two legs that are swollen. Is that correct, Paula?
That's correct. That's correct.
Oversized legs. And can you only receive it in your legs? Can you only get it in your legs?
No, you can get it in any part of your body, any limb, any part. You can get it anywhere. I've had people hip, leg, arms, breast, any part of your body.
Okay, so after this call, Marla is going to be on her Facebook page. If you can go to her page and let her know how much you appreciate it. She's doing a live right now from her page.
Yes.
With a comment, say, I watched your live. And let's hashtag Marla McCants this morning. Hashtag Marla McCants. And if you are familiar with Lost, living our shared stories, you can hop on over to our Facebook page at lost.net, LOSS.EVENTS. We're about 20 lights away from having 1,100 followers. line, and she is going to encourage you and inspire you and motivate you. She has a story of truth and difference and things in life that you know anyone that ever did rock bottom. You need to listen in next week with our guest, Christina Fagan, who's going to share some insightful news on how you can get back up again. Marla, on behalf of the Lost Network, I want to thank you for being a part of this call and for those who joined in. And I would like to ask if you have any final remarks before we close out this call.
Yes, I just want to thank you. Thank you again for having me on here. Like I said, this is a very important topic for me because it affects me. And as I've been going through my experience, like I said, just not for myself, it's for others. Get sick and you'll find out who loves you in life. As I tell everyone now, I'm living on borrowed time. A lot of people may not understand that it's between me and the Lord above. And my job is to get out and let my brothers and sisters know about this and what can be done. And don't be ashamed. I just recently missed, my girl Kathy Bates. She was here with the lymphedema here. I just missed her. I've joined organizations, and I'm going to be getting out, passing on this information. Like I said, I'll be on Sister Circle next week, and I'm just going to keep going forward, passing out information and helping change, educate others that are suffering with health. And I do thank you and so much for this opportunity, and I hope that I reach some people out there that really can use this information. Thank you.
All right. Well, thank you, Marla. Well, thank everyone for tuning in. Tune in next week, same time, Wednesday. Special guest Christina Fagan will be with us. Total Life Changes. She's a travel consultant. She's a motivational speaker. She's an author. And she's also a Lost VIP Change member. And then the week after that, we'll have Portia Alhaas with her. She's a domestic violence survivor. And she literally has truly survived domestic violence. So we have a lot of calls coming up that are great for you to hop on and share the great things that Lost is doing. Let us build this network together and let us continue to share positive news and help people. Send Marla a note today. Let her know your prayers are with her as she goes to the hospital. We're praying for you today, Marla, that you will be strong. You will pray for your legs, and God will continually touch and heal you. When man says there is not a healing for lymphedema, God, we say you can do all things, God, and we just thank you for touching Marla today and giving her the strength. And Lord, this people away to help her, and we praise you. And we thank you again for every call today. For everyone, we'll move on the phone line for Lost. We're not just going to remember to follow us on Facebook. Thank you, Marla.
Thank you. All right. Okay. As I'm just finishing up, I was on the phone on Lost Meetups. I was doing a conference call talking about lymphedema, so I decided to take those that are just joining in with a conversation, and that'll be it. Thank you. Thanks for watching.